Let's go live now to Victoria, where the Health Minister is giving an update on coronavirus.
Commander Jerome Weimar, and we just want to take the people of Victoria through where the situation for both the current outbreak of the COVID-19 position is, together with testing and vaccination updates. So currently there are 45 active cases of coronavirus in Victoria in total. Yesterday we recorded 5 new locally acquired cases, 4 at the City of Whittlesea end of the outbreak, and a further 1 linked to the Port Melbourne workplace outbreak. And I'll get the COVID response commander to take us through some more of that detail in a moment. The other 2 cases were overseas acquired hotel quarantine cases. 2 days ago, we set a record for our COVID-19 tests and equally for our vaccinations in Victoria, and we did it yesterday as well, and today we land a hat trick of records. There were yesterday 21,626 vaccinations in our state-run centres, and when you include the great work still being done by our GP network, that's well over 40,000 vaccinations in Victoria yesterday. I'll take this opportunity to remind everyone that more vaccines and more GPs are coming into the network, and as they are invaluable partners in the vaccination program delivery. And yesterday there were also a further record of 56,624 COVID tests. We know, as a result of this evidence, that the people of Victoria are rightly taking this outbreak incredibly seriously and are also responding to the vaccination program as our way to get out of this COVID pandemic. So we are grateful equally to not just those people who got tested and got vaccinated, but we are even more grateful to the millions of Victorians who are doing the right thing and who are observing the 5 reasons as to why we can leave home. And in doing that, whether you're observing those reasons, whether you're getting vaccinated or you're getting tested, you are doing your bit to help our state stay safe. Our contact tracers are continuing to run hard and fast at this outbreak, and they continue to make their way through new investigations and interviews and identifying new lines of inquiry all the time. The Chief Health Officer's update last night brought into line some of those inquiry outcomes. One in particular I want to focus on was an individual who worked during their infectious period. I stress when they showed no signs of the COVID symptoms themselves, for a food distribution centre, and who visited multiple stores and grocery sites across metropolitan Melbourne on the 18th and 19th of May. As a result of those inquiries, a large number of further Tier 1 exposure sites have been added to the websites for the coronavirus update. I want to thank that company and their customers for their efforts in cooperating with our contact tracers and the department in rapidly tracking down so many of the contacts and providing outstanding assistance in making sure that we've started the testing process for all of those contacts. I can advise that the City of Whittlesea cases announced today, those parts that I referred to earlier, are actually linked to this particular case. They are direct personal close contacts, social contacts of that particular individual. The high-risk exposure sites are a number of these grocery stores in both the northern and southeastern suburbs, and they were over a number of short visits on the 18th and 19th of May. There was a further Epping grocery store that was listed for a much longer period of a visit by this particular person, as well as a Mill Park car wash. All of these new exposure sites relate to this one particular case. So can I use this opportunity to encourage everyone to check those exposure site websites and see if they have visited any of those. As a result of this, people variously in Epping, Wollert, Dandenong, Craigieburn and a number of other related suburbs will be receiving text messages today advising them to do precisely that, to check the website, to check if you are caught by the Tier 1 exposure requirements, which, to reiterate, are to isolate, to get tested and to continue to isolate for 14 days. There are also a number of other settings that Department of Health is managing in relation to these cases, not all of which are published online because we have the details of everyone who attended those venues and who may well be at risk. One such venue is Mount Ridley College in Craigieburn. The Department of Education are working closely with the school and the principal, who has been in touch with the school community last night. My message to that community is that the Department of Health will contact you if there are any actions that you need to take. Unless you have symptoms, in which case, as for everyone in the state of Victoria, please get tested immediately. I want to assure that school community that we're managing this site closely and carefully and in a high level of cooperation with the school community leadership. I have strong confidence in our teams and our local public health units who are working together across all of these new exposure sites in response to this outbreak from South Australian Hotel Quarantine being seeded in Victoria for us to get on top of this. We know that there is more that we can do, and we are continuing to ramp up our efforts in response to the growing list of exposure sites. This is where you can help us, the people of Victoria. We are in day 2 of this circuit breaker lockdown, and we will get through it by us all following the rules. And thanks to everyone who is staying home, there are only those 5 reasons to leave your home. Firstly, shopping for essentials, for exercise, for medical care and caregiving, including getting a COVID-19 test, work or study if you are authorised to get vaccinated, is the 5th. If you aren't doing any of these things, it's a pretty simple message. Please stay home and keep yourself safe and keep your community safe. That's how we will get through to the other side of this circuit breaker lockdown. That's how we will keep Victoria safe, and that's how we will yet again show that we are capable of running this outbreak down and keeping Victorians safe